Well, I think in Warrington, we've been very lucky because we've had a lot of commitment to the Home Improvement Agency over the last couple of years, and I think we've benefited from that really because Warrington Housing Association, as a managing agent, really put a lot of investment into the agency, and alongside our partners in the local authority, we were able then to develop our services greatly. I think the thing that's different, I suppose, about us is that we've got a lot of private clients. We support a lot of people who are self-funding, as well as doing the DFG work, as well as doing the grant work and the minor adaptations through the handy person service. And in recent years, things like the gardening service that we've really developed in partnership, I suppose, through being asked for services, we've thought, right, there is a need here, so that's something that we've managed to really invest in and to develop. And I think purely the range of services that we're able to offer, I suppose, is something that sets us apart. I mean, I think in terms of ethos in the Home Improvement Agency sector as a whole, there is obviously a very person-centred, caring ethos across all home improvement agencies, and we are no different in that. So very much focusing on the caseworkers actually seeing somebody in their own home environment, about the range of services being there to support where other services can't do that. That's very much our ethos, and it is very much a community-based project in that sense. We only operate in Warrington, we only therefore have partners. It is a unitary authority, which makes things a bit easier for us in Warrington. We can work and build long-term partnerships, and that really is our ethos. We are here to support owner-occupiers. I think sometimes when you work in the housing sector, it's easy to forget that 85% of clients are homeowners, because when you work in a housing association or a local authority, you're very provider concentrated, when 85% actually are responsible for their own repairs, for their own maintenance, and we're very aware of that in Warrington, and actually there is a gap in service provision there, and that support that a home improvement agency can offer is complementary to the work of social landlords, and that's very much our ethos, that this is a group that we really want to support as much as we can. Our major challenges, obviously funding is top of the list there. We are beginning to see through our service delivery the impact that cuts in social care have had. We are beginning to see through the raising of the threshold fewer things coming through that we would traditionally have done in minor adaptations, and funding is an issue right across the board. In Warrington, as everywhere else, we have a growing older population and probably less support for them, so there is an issue there. And I think in terms of working with partners, that's key to what we do. We really need to be integrated in this system, and it's very difficult to work with partners when structures are changing, when staffing are really undercuts, there are fewer staff in certain areas. So as a home improvement agency, trying to work with social care hospital teams who are constantly under change and under threat, that I think is one of our major challenges this year. One of the things that we developed in 2013 in partnership with our housing association is the Lifetime Project, which is a really exciting development for us because it is around tackling social isolation. It is a project where we hope to work with people who are over 50. We have a centre, but it is a neighbourhood approach as well. So what we're hoping to do is to incorporate the five ways to wellbeing. So offering opportunities for people to connect, to give back, to enjoy their life and to keep learning. And in the Lifetime Centre, we've got a whole range of services on offer. And given that we only opened on 1st of August 2013, it's quite surprising to see the range of services that we do have. We've got everything from art to Zumba. We've got yoga, we've got ukulele, we've got arts, crafts, all manner of things. Trips are very important, and The Christmas party at the end of the year was kind of a celebration of all the work that our volunteers have done over the first quarter, and looking at the enthusiasm and the ideas that they've got for roving lifetime out around the neighbourhoods, it's going to be quite something. So one of the new projects that we are piloting at the moment is called our Home Cash Plan, and that is a local scheme for owner-occupiers who need essential repairs, and we offer funding for those essential repairs, which is then added on to the value of the property. So when the property is actually sold, that we get the money back that's owed on the loan. What it does, I think, certainly for our first couple who we've helped through this scheme, what it meant for them was they had a property that they lived in all their life. They were around the age of 75, and Mrs. Buckley, who benefited from the scheme, was actually still working in a cleaning job to try and pay for some of the repairs that were needed. They were acutely aware that the roof on the back of the house was at the end of its life and was just about to collapse, which was a constant source of worry for them. When they approached us at WIA, we were able then to offer them Home Cash Plan, which meant that we would take care of the roof and the costs of that and organise everything for them. But they also wanted to have the bathroom refurbished so that it met their needs as they get older. So for them, they felt it was the perfect way of actually getting what they need right now. The way that we funded this is through pilot funding of £50,000. So what we're doing is working with some of the people who are coming forward to us to see whether it actually suits their needs. Obviously, equity release type products are not for everyone, and it does have to meet specific needs, so we're very careful about that. Where we can't help somebody through Home Cash Plan as a last resort, there are other things that we can offer, and we find it to be very, very useful. I think what we know about the home improvement agency sector is that we are so diverse. Every agency is so different, and it's not easy to make comparisons. I think for us in Warrington, one of the things that is bearing fruit, or beginning to right now for us, is through the Venture Care Fund. We've always had very good relationships with our public health colleagues, with our social care colleagues, and in recent months we've been working towards putting a proposal to our Integrated Commissioning Board. We have heard in the first week of January that our proposal was met kindly by them, and they have decided that the Home Improvement Agency is something that collectively Health and Social Care would like to invest in Warrington. It's very early days for us, but for me that represents a real step forward. What it will allow us to do, if the agency is invested in, is to take that step forward, to move on to a more proactive approach, to work with high risk clients to make sure that the services that they may not know they need are brought to them as soon as possible. And I think it also has the benefit of helping hard-pressed health staff to get the right job done by the right person. There is no point, I think, in OTs, social workers or whoever trying to find solutions for broken heating, for leaking roofs. That is a home improvement agency core skill, and that's where it should sit. And I think by making the right linkages and integrating in the right way, letting us do the right job with the skills that we have in the agency, will free up resources for other things. So I think we've had some success with this. It is early days. I am hoping that we will be able to extend and improve the range of services and casework time that we've got, so that we can really benefit older people in Warrington.